Today we are going to talk about the superficial peroneal nerve and we are going to study it thoroughly. First of all, let us talk about the introduction of superficial peroneal nerve. The superficial peroneal nerve is the main nerve of the lateral compartment of the leg. So what is first point in introduction? It is main nerve of lateral compartment, and the second point is it is the terminal branch of common peroneal nerve. It is the smallest terminal branch of common peroneal nerve. This is all about the introduction. Now we are going to talk about the course and relations of the superficial peroneal nerve. So suppose this is neck of the fibula and this is lateral side and this is medial side. For comprehensive understanding, I am going to divide the lateral compartment or the leg into three segments, that is upper 1/3, and this is middle 1/3, and this is lower 1/3. So now let us talk about the course. The common peroneal nerve wounds around the neck of fibula, from the lateral side. It wounds around the neck of fibula, and here lies the muscle, peroneus longus muscle. Here lies the peroneus longus muscle. Within the substance of this peroneus longus muscle, the common peroneal nerve divides into two terminal branches, of which one is superficial nerve, that is we are going to talk about. So this is superficial and this is deep peroneal nerve. The superficial nerve in the upper 1/3 descends downwards in the upper fibers of peroneus longus muscle. In the upper 1/3 of the lateral compartment, the superficial peroneal nerve runs in the upper fibers of peroneus longus muscle. So what is this? This is peroneus longus muscle. In the middle 1/3, it lies between peroneus longus and peroneus brevis muscle. So this is peroneus longus muscle, and suppose this is peroneus brevis muscle. It lies between peroneus longus and peroneus brevis. So this is peroneus brevis muscle. Peroneus brevis. And in the lower part of the middle 1/3, it lies in the groove between peroneus brevis muscle and extensor digitorum brevis muscle. So this is extensor digitorum brevis. This is not the muscle of lateral compartment, but it is the muscle of anterior compartment of the leg. So this is extensor digitorum longus muscle. It lies in the groove. Here is a groove between peroneus brevis and extensor digitorum longus muscle. At the junction of middle one third and lower one third, it pierces the deep fascia. It now pierces the deep fascia. Here lies deep fascia, and it becomes superficial or cutaneous. Then it divides into two terminal branches. At this point, it divides into two terminal branches. One is medial and second one is lateral. So this is medial terminal branch, and this is lateral terminal branch. Now this landmark is ankle joint. And this is dorsum of foot. Dorsum of foot. The medial and lateral terminal branches crosses the ankle joint and reaches the dorsum of the foot, and there they supplies most of the dorsum of foot. This is the cutaneous innervation. The medial terminal branch crosses the ankle joint and reaches the dorsum of foot. It then divides into two dorsal branches, to supply the two dorsal branches. It divides into two dorsal branches. One is for the medial side of the big toe, and second is for the adjacent sides of second and third toe. This is first, this is second, this is third, fourth and fifth. It divides into two terminal branches, two dorsal divisions. One is for the medial side of the big toe, and second one is for the adjoining side of second and third toe. Now the lateral terminal branch also crosses the ankle joint and reaches the dorsum of foot, where it divides into two dorsal divisions. Two dorsal divisions like this, and it supplies the adjoining sides of third and fourth and fifth toes. So this is the innervation of the medial and lateral terminal branches. So this is first and second of the medial terminal, and this is first and second of the lateral terminal branches. Dorsal digital branches, because they are going to supply the digits, so these must be digital branches. Dorsal digital nerves, or branches of the medial terminal and lateral terminal branch of the superficial peroneal nerve. So this is all about the course and relations of the superficial peroneal nerve. Let's talk about its muscular supply. Muscular supply. The superficial peroneal nerve innervates the muscles of the lateral compartment. As we know, lateral compartment, and this includes two muscles, namely peroneus longus muscle, peroneus longus, and peroneus brevis muscle. Cutaneous innervation. Cutaneous innervation is cutaneous innervation. As in the junction of the middle one third and in lower one third, it pierces the deep fascia and becomes cutaneous. So it supplies the lateral side of the lower third of the leg, lateral side of the lower of the leg, and most of the dorsum of foot, including which I have explained earlier. So it also supplies lower 1/3 of lateral compartment of leg. I have explained the cutaneous innervation of the superficial peroneal nerve practically, and also I will explain the cutaneous innervation of foot and hand practically. So stay tuned. If you like my work, please like the video and subscribe to my channel. If you want that I will make that informative videos, please subscribe to my channel and share it with your fellows. Thank you very much. Let's have a quick review. What is superficial peroneal nerve? This is the main nerve of the lateral compartment and the smallest terminal branch of the common peroneal nerve. What is the course? When the common peroneal nerve winds around the neck of fibula, it terminates into two terminal branches in the upper fibers of the peroneus longus muscle. One is known as superficial peroneal nerve. In the upper 1/3 of the lateral compartment, it lies in the substance of peroneus longus muscle, and in the middle 1/3 it lies in between the peroneus brevis and peroneus longus muscle, and in the lower part of the middle 1/3 it lies in the groove between the extensor digitorum longus and peroneus brevis muscle, and at the junction of middle 1/3 and lower 1/3 it pierces it deep fascia and become cutaneous, and also it gives the two terminal branches. One is medial terminal and the second is lateral terminal. Both the branches crosses the ankle joint and reaches the dorsum of foot, where they divide into two dorsal digital nerves each. The medial terminal branch supplies the medial side of the big toe and the adjacent sides of second and third toe, and the lateral branch innervates the adjacent sides of third and fourth and fifth toes. So this is the good innervation. What about the muscular supply? Muscular supply up through the lateral compartment of the muscle peroneus longus and peroneus brevis muscle, and its cutaneous innervation that I have explained earlier, and also to the lower 1/3 of the lateral compartment of the leg. This is all about. Thank you very much.